Hello friends, welcome to the channel Dewdear Academy. Here I am discussing a question paper of the staff nurse examination, that is SCT, Sree Chitra Institute for Medical Science and Technology examination which is conducted in 2019, that is 11/8/2019 question paper I am discussing here. I have already uploaded 15 questions of this question paper discussion. And now I am giving the remaining explanation of the remaining questions. Question number 16 to question number 30. That is another 15 questions I am discussing in this video. So let me start. The first question is, to prevent the pulmonary embolism, heparin must be continued until the international normalized ratio INR is within the therapeutic range of. Options are 1 to 1.5, 1.5 to 2, 2 to 2.5, 2.5 to 3. So the question is, to prevent the pulmonary embolism, how much the heparin must be continued until the INR ratio is within what range? So till what range of INR we have to administer heparin? That is the question. So here the answer is 2 to 2.5. INR range of 2 to 2.5 is the therapeutic range for the INR in which the heparin must be continued to prevent the pulmonary embolism. So 2 to 2.5. Then question number 17. Patients who receive continuous or timed interval feeding should be positioned semi-recumbent during the feeding and for a minimum of. Options: 15 minutes afterwards, 20 minutes afterward, 30 minutes afterward, 40 minutes afterward. That is, the patients who are receiving continuous or timed interval feeding, so they should be positioned as semi-recumbent during the feeding and afterwards for how much time? That is the question. So the correct answer is 30 minutes. 30 minutes is the correct answer. These patients, for after receiving this continuous or timed interval feeding, they should be positioned semi-recumbent during the feeding and for a minimum of 30 minutes afterwards the feeding. The next question, the minimum length of an effective pulmonary rehabilitation program is. Options are 4 weeks, 6 weeks, 8 weeks, 10 weeks. What is the minimum length of an effective pulmonary rehabilitation program? So the correct answer here is option B, that is 6 weeks. Minimum of 6 weeks pulmonary rehabilitation program should be given for an effective program. Okay, the minimum length of an effective pulmonary rehabilitation program is 6 weeks. Then question number 19. The tracheostomy tape should be adequately tightened to prevent dislodgement. Tighten the tape until only. So the tracheostomy tape should be adequately tightened in order to prevent the dislodgement. So how much tightening is required? That is the question. Tighten the tape until only. Options are: 1 finger can be comfortably inserted under it, 2 fingers can be comfortably inserted under it, 3 fingers can be comfortably inserted under it, and 4 fingers can be comfortably inserted under it. So for how much is the level of tightening required? That is the question here. So here the answer is 2 fingers. The tighten the tape until only 2 fingers can be comfortably inserted under it. So option B is the correct answer. Then question number 20. One of the criteria to wean a patient from ventilator is vital capacity, which should be. Options are 5 to 10 ml per kg, 10 to 15 ml per kg, 15 to 20 ml per kg, 20 to 25 ml per kg. So what is the criteria to wean a patient from ventilator? That is, if the vital capacity, what should be the range of the vital capacity in order to wean a patient from ventilator? That is the question. So the vital capacity should be 10 to 15 ml per kg. Vital capacity should be 10 to 15 ml per kg in order to wean a patient from ventilator. Correct answer is option B, that is 10 to 15 ml per kg. Then next question. Usually no drains are used after pneumonectomy because options: blood loss is usually minimal, drains may cause pneumothorax, it is difficult to remove the drains, mediastinal shift is prevented. So question is, usually no drains are used after pneumonectomy because the reason is mediastinal shift is prevented. In order to prevent the mediastinal shift, that is the reason for using no drains after pneumonectomy. Usually no drains are used after pneumonectomy because mediastinal shift can be prevented. That is the reason. Then question number 22. The highest priority when promoting oral hygiene to an unconscious patient is to. The highest priority when promoting oral hygiene to an unconscious patient is to. Options: prevent aspiration, prevent unpleasant mouth odor, prevent dental caries, prevent mouth ulcers. What is the highest priority when promoting oral hygiene to an unconscious patient? So here the answer is in order to prevent aspiration. When we are providing the oral hygiene to an unconscious patient, it is important to take care of preventing aspiration rather than all other options, preventing unpleasant mouth odor or prevent dental caries and preventing mouth ulcers. The most important priority is prevent aspiration. Then question number 23. In buccal administration of drugs, medication is kept in the mouth against the mucous membrane of. In buccal administration of drugs, the medication is kept in mouth against the mucous membrane of. Options: the cheek, the tongue, the teeth, the palate. So here the answer is the medication is kept in mouth against the mucous membrane of the cheek. That is the correct answer. Buccal administration of drugs means that medication is kept in mouth against the mucous membrane of the cheeks. It is not the tongue, teeth or palate. The answer is against the cheeks, membrane of the cheeks. Then question number 24. A stroke patient uses his stronger extremities to give range of motion exercise to the weaker extremities. This is an example of. Options: passive range of motion exercise, active assistive range of motion, then active range of motion, resistive range of motion. So these different types of range of motions are given: active, passive, active assistive and resistive. So the question is regarding the range of motion exercise. The stroke patient uses his stronger extremities to give range of motion exercise to the weaker extremities. So what type of range of motion? This is an example for which type of range of motion? So this is an example for passive range of motion. Okay, this is an example of passive range of motion. Then passive range of motion exercises prevent. Options: contractures, osteoporosis, muscle atrophy, renal calculi. What is the purpose of providing this passive range of motion exercise? Whether it is to prevent the contractures, osteoporosis, or to prevent muscle atrophy, or to prevent the renal calculi. The correct answer is in order to prevent the contractures. Passive range of motion exercises are given in order to prevent the contractures. Then question number 26. When assisting a patient to stand following a prolonged period of bed rest, the nurse must carefully assess for. When assisting a patient to stand following a prolonged period of bed rest, the nurse must carefully assess for. Options are steadiness of gait, respiratory rate. Option C, orthostatic hypotension. Option D, dependent edema. So if after a prolonged period of bed rest and if a patient is getting assisted to stand, so what should the nurse carefully assess for? That is the question. So it is important to assess for orthostatic hypotension. Okay, it is important to assess for orthostatic hypotension when the nurse is assisting the patient to stand following a prolonged period of bed rest. Then question number 27. Tab propranolol 100 mg QID oral has been prescribed by the physician for a patient. The nurse finds that only 40 milligram tablets are available. So how many tablets will she administer? So here the answer is 2.5. This is you have to note the drug calculations. This is from the drug calculation section. So the answer here, in order to administer the number of tablets should be administered is 2.5. Then question number 28. Measuring the pH of the aspirate is a recommended method to confirm the placement of the nasogastric feeding tube. So which of the following pH value shows that the tube is in the stomach? Measuring the pH of the aspirate is a recommended method to confirm the placement of the nasogastric feeding tube. So what pH value shows the tube is in stomach? So if the pH value of 5 indicates that tube is in stomach, pH value of 5 is the pH of the aspirate should be 5, and that is indicating the tube is in the stomach. Then question number 29. The size of the catheter used for urinary catheterization for adult is 12 to 14 French, 8 to 12 French, 5 to 8 French, 3 to 5 French. What is the size of the catheter used for urinary catheterization for adult? Answer is 12 to 14 French. 12 to 14 French is the size of catheter that is used for urinary catheterization for adult. Then question number 30. What is the expected condition for a patient with given ABG values? pH 7.5, PCO2 46 millimeters of mercury, bicarbonate is 30 milliequivalents per deciliter, and potassium 3.4 milliequivalents per deciliter. So what is the expected condition for this patient with these ABG values? The correct answer is metabolic alkalosis. This is indicating metabolic alkalosis. Okay, metabolic alkalosis is the correct answer. So this is the second part of this question paper discussion. So I will be continuing the uploading of videos of the remaining part of this question paper. So hope you all will watch this. Thank you.